See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association, and hosted by nurse economist and health tech specialist Shauna Butler.
The history that's taught on American Indians is not an accurate picture of what happened, and it is still not accurate. You think about how important your culture is to your family and carrying on those traditions. So those were stripped starting with the boarding school era. The last residential boarding school closed in 1996. So you think about the dynamic of the family and how that's changed when you grew up in a boarding school and not in a family unit. There are multiple consequences from that. These are things that would be really helpful for nurses and for faculty to know when they are working with American Indian and Alaska Native students and patients. It should completely shift what your care looks like and how you support them. I really want to be intentional about flipping the narrative and focusing on the positives and what American Indians bring to this country, what they have since it started. We do have this power and this strength in our communities and the traditions and the language. And one of the things that I really hope to see from the Pathway Initiative is our nurses that are currently working in Indian Health Service, for them to be the leaders when they graduate with their DNPs in health innovation and leadership, and to really make some much needed changes within IHS so we can improve the health outcomes of our tribal and urban communities.
Welcome to See You Now. I'm Shauna Butler. American Indian and Alaska Natives, the original inhabitants, explorers, and settlers of the United States, have rich cultures, traditions, histories, and languages. And each year during November, we pause to honor and reflect on the contributions, survival, and legacy of the tribal nations and indigenous communities in the U.S., and to ensure their rich histories and contributions continue to thrive with each passing generation. This national observance also serves to raise awareness and action about the various challenges faced and endured by Indigenous communities, and to lift up the remarkable work, strengths, and relationships being forged at the intersection where access to better health outcomes meets efforts to build representative, culturally competent workforces. In 2024, the U.S. Department of Health and Human Services Office of Minority Health observes Native American Heritage Month with the theme, Be the Source for Better Health, improving American Indian and Alaska Native health outcomes through our cultures, communities, and connections. See You Now is proud to be part of this listening, learning, and source for better health by sharing the story of how Misty Wilkie, a Chippewa Indian nurse researcher and educator, brings her heritage, lived experiences, advanced degrees, and ancestral strengths to improve the health, practice, and representation of her community in the healthcare workforce.
I'm the director of the Pathway Initiative at the University of Minnesota School of Nursing, and I work very closely with Dr. Margaret Moss and Dr. Lisa Martin-Renneke, who are also American Indian PhD prepared nurses. We provide the mentorship for students. There's also a Center for Indigenous People Health and Nursing housed within the School of Nursing. So each of these provide different supports for the students. I would like to introduce myself in Ojibwe Moan, Buju Indinaway Maganadog, Misty Wilkie Indigenous, Makwa Ndudum, Mikanakwa Ju Ndunjaba, Miigwech Bizantawiye. Hello, my relatives. My English name, or my colonial name, is Misty Wilkie. I am from the Bear Clan, and I come from the Turtle Mountain Band of Chippewa Indians in North Dakota. And thank you for listening. Our introductions tell a story of where we come from, our clan, our tribal nations, and along with that comes a long history of where my people originated from. And so it's an important way to identify who I am and where I come from. And when I am with other American Indian, Indigenous folks, it provides a conversation starter of how we might be related.
So, Misty, the way I hear people describe their heritage and the land and the influences, it speaks to the soul. And so just say a little bit more about the Bear Clan and some of those things that you would love for other people to know.
So one of the things that I resonate with most with the Bear Clan, bear are protectors. They are also medicine givers. So historically, bear have led ancestors to medicines in the forests. And so they have provided medicine to cure different diseases or to help with different ailments. And we know they're also very fierce and protective of their cubs, for example. And so these are definitely traits that I carry with me in my profession and my personal life to provide medicine through nursing care, but also through the support work that I do for American Indian, Alaska Native nursing students. I think providing that level of support is a way in itself of providing medicine, and just the protective factors of my students and my children, my family, definitely traits that I hold close to my heart of what the bear represents.
As you're saying that and smiling at me, I'm thinking, this is where that phrase, the mama bear, this is where the mama bear comes out in me. And I oftentimes think that we forget where those ideas and those phrases, that when you say it, people know exactly what you're referring to. So let's talk about some of the nursing students that you are the mama bear, and more formally, the director of the Doctoral Education Pathway for American Indian and Alaska Native nurses. I'd love for you to share a little bit more about this great need for American Indian and Native Alaska nurses, considering that less than 1% of our nursing workforce identifies as American Indian or Alaska Native.
Yes. So I think it's important to start out with the first HRSA nursing workforce diversity grant that I led, and that was at Bemidji State University and where Naganawenimananig was created. One of the beautiful things about Ojibwe is it is a very descriptive language. So one word, Naganawenimananig, breaks down into we take care of them. And that's what the program is, holistic support, wraparound services for students. So this HRSA Nursing Workforce Diversity Grant focused on American Indian, Alaska Native nursing students at the undergraduate, pre-licensure, and RN to BS level. This program, it's still in place, started in 2017, initially received $2 million of support for a 4-year program. So Naganawenimananig, along with the Pathway Initiative, which is the program at the University of Minnesota, they are both akin to us teaching nursing students how to be culturally humble or to provide cultural humility with the care that they give to their patients from underrepresented and marginalized communities. We want to recognize those unique circumstances and situations, backgrounds that our patients come from, and to match that and to provide equally unique care for them. So with the Naganawenimananig and Pathway programs, we provide cultural academic and social support for students. So it isn't enough to just recruit these students to the institutions. You have to do what you can to get them to the finish line, to get them graduated, and then get them licensed if it's pre-licensure or advanced practice nurses. Things that we do to help with this process are providing mentorship, having students meet regularly and consistently with an American Indian PhD prepared nurse, somebody that's been in their shoes before and knows exactly what they're going through, has grown up on reservations just like they have and have endured some of the tragedies that they might experience, somebody that understands what family looks like. This is something that faculty need to be aware of when working with American Indian students, is that there might be 4, 6, 8 sets of grandparents beyond biological. And so recognizing that there might be a lot of death in a student's family, and they could have a grandparent die 3 times in a year. And rather than question, really, you had 3 grandparents die this year, to flip the narrative on that and say, oh my gosh, I am so sorry that you've had to deal with so many deaths in your family. So helping faculty to recognize some of these unique attributes that students might encounter as they progress through their programs. The social piece of it, and this is something that I experienced as well. I grew up on reservations up until my early 20s, and the first time I left the reservation was when I attended University of North Dakota. It was the first time I lived more than 30 minutes away from my family, and it was a real culture shock to me, and it was quite a lonely process. And to be able to provide a sense of community away from home for these students is paramount in their success. So if we have a student that gets to the point where they want to quit, whether things are getting too hard academically or they're struggling keeping up with their family obligations and their academic coursework, and they say, I can't do this anymore, they have a community already built in that says, nope, you can't quit. Let's figure it out. What do we need to do to help you keep going? And that's really critical in getting more of our students graduated and out in the workforce.
Completely critical. And the support network is university-wide. It's really woven in to the fabric. And I think that that's a credit to your guidance and wisdom, that this is how Indigenous communities actually behave. It is tribal.
Right.
And, we use that word and we're adopting it because it has a very strong, powerful meaning, this way to identify this organization, this sense of safety and identifying and belonging. I'm sticking right now specifically to the Doctoral Education Pathway. We need to have educators, leaders, providers of the communities that have been historically underrepresented and underserved and marginalized. And they're like the magnet. I think that there is this belief of we need to start with getting people into a entry-level nursing program, but focusing on the multiplier effect. If we have leaders and providers and educators, that is the multiplier. Right. And so it's both. It's the pathway. But I just wanted to have you speak to the PhD program, the Education Pathway program. Who's part of this? Who's attending? What are the numbers? What is the impact? What are the things that you're really proud of?
My favorite quote is from Marion Edelman Wright, and it is, "You cannot be what you cannot see." And so to have representation of American Indian, Alaska Native nurses with a DNP or a PhD teaching in universities, conducting research in the community, providing advanced practice care in Indian Health Service and tribal health clinics, those are really important for the youth to see that these are some possibilities of what they can do. As far as the multiplying effect, one of the things that I really hope to see from the Pathway Initiative is our nurses that are currently working in Indian Health Service for them to be the leaders when they graduate with their DNPs in health innovation and leadership, and to really make some much needed changes within IHS so we can improve the health outcomes of our tribal and urban communities.
As you're talking about leaders in the Indian health services, when you have Indigenous leaders and nurses, they are also informing the curriculum and infusing the teaching. There are multiple benefits here. There's so much Indigenous wisdom that all nursing curriculum, all of our health curriculum is really going to benefit from. And you understand this so well because of your personal journey, your personal professional journey, and the experience that you've had. Your story, I will say, it's beautiful. It is uplifting, it is courageous, and it has informed who you are and the programs that you developed because you have so much understanding of the historical context of why there are health disparities, why there's marginalization, why there are poor health outcomes. What insights do you have that's guided how you lead and how you create these programs?
The history that's taught currently and historically on American Indians is not an accurate picture of what happened, and it is still not accurate. We're still dealing with teaching things about Columbus Day on October 14th, which a lot of people have changed to Indigenous Peoples Day to, again, change the narrative and help highlight the systemic racism that continues on. In 1956, the Indian Relocation Act was implemented. The government forced American Indians to live on reservations. The intent of these was to disrupt the family unit. Young children, as young as 3 years old, were kidnapped from homes and placed in boarding schools. They weren't allowed to return home. They weren't allowed to see their families. Their hair was cut. They were punished for speaking their language. And by the time these children graduated, if they did, the graduation rate at boarding schools was atrocious. But by the time they returned to their home communities, they were so ashamed of being American Indian, and this caused a loss of our traditional practices, but most importantly, our languages. Every American Indian person that you know today has been affected by boarding schools. They're a survivor, either themselves, their parents, or their grandparents, and I am no exception to that. My dad and my grandmother are boarding school survivors. You think about how important your culture is to your family and carrying on those traditions. Those were stripped starting with the boarding school era. The last residential boarding school closed in 1996.
Sacred traditions, culture, passed down over thousands of years. Long before there was a United States, Native communities flourished on these lands. They practiced democratic government before we ever heard of it. Developed advanced agriculture. Contributed science, art, and culture. But eventually, the United States was established and began expanding, entering treaties with sovereign tribal nations. As time moved on, respect for tribal sovereignty evaporated, was shattered, pushing Native people off their homelands, denying their humanity and their rights, targeting children to cut their connection to their ancestors and their inheritance and their heritage. Then the federal government mandated the removal of children from their families and tribes, launching what's called the Federal Indian Boarding School era, one of the most horrific chapters in American history. We should be ashamed, a chapter that most Americans don't know about. As president, I believe it is important that we do know. Generations of Native children stolen, taken away to places they didn't know, with people they never met, who spoke a language they had never heard. Native communities silenced. Their children's laughter and play were gone. Lost generations, culture and language, lost trust. It's horribly, horribly wrong. It's a sin on our soul. I formally apologize as President of the United States of America for what we did. I formally apologize. I have a solemn responsibility to be the first president to formally apologize to the Native peoples, Native Americans, Native Hawaiians, Native Alaskans, and federal Indian boarding schools. It's long, long, long overdue. Quite frankly, there's no excuse that this apology took 50 years to make.
That was President Joe Biden on October 25th, 2024, formally apologizing for the federal government's role in running boarding schools where thousands of Native American children endured abuse, neglect, and eradication of their tribal identities. This was the first time a U.S. president officially apologized for the government's role in the forced removal of Native peoples from their homes and ancestral homelands. We used President Biden's remarks courtesy of C-SPAN.
And so to think about how many of these American Indian children grew up in boarding schools and were physically, sexually, emotionally abused, didn't receive love, they weren't hugged, they weren't kissed, and now they're becoming parents. What does that look like? So you think about the dynamic of the family and how that's changed when you grew up in a boarding school and not in a family unit. So there are multiple consequences from that, whether it's mental health issues, addiction issues, physical abuse issues. I mean, there are just so many things. Another example is the Indian Relocation Act of 1956. So American Indians are still doing too good for the government. So the U.S. enacts the Indian Relocation Act and tells American Indians, move to big cities, Minneapolis, San Francisco, Chicago, all across the country. The goal of this was really to assimilate American Indians into the general population and take away their culture. Move there, we'll help you get vocational training, we'll give you jobs, we'll give you health insurance, we'll help you find a place to live. Sounds really exotic, getting them off the reservation, providing this false sense of security. And people move. And my dad was one of them. And I didn't learn this until, 5-6 years ago, that my dad was part of this and moved to California and was struggling so much financially that my mom ended up going get him. They came back to North Dakota. And so I often think how different my life would be if I grew up in a big city in California versus in rural tribal reservation lands throughout North and South Dakota. So again, how does this impact our students today? How does this impact our patients today? So these are just a couple of examples of things that would be really helpful for nurses to know and for faculty to know when they are working with American Indian and Alaska Native students and patients. It should completely shift what your care looks like and how you support them.
Well, I think that speaks to, and I don't use this word lightly, a transformative power of the programs that you've established. What you just shared, and through your own lived experience, that is why you are so well prepared and spiritually guided in how you're putting together the program by respecting many of the restoring many of the traditions and the wisdom of Indigenous peoples. As people listen to these stories, they start to see all of the threads coming together, why all of these things matter, why when somebody shows up and the way they seek care, it's like, oh, that makes sense in this context. I know that this is not part of your tradition and is very hard. Can I get you to share how successful and the great impact that both of these programs have had? And then I'll brag about you, okay?
Okay. Yes, that's not in my culture to boast. But we have this year 19 American Indian, Alaska Native DNP students enrolled. And I am so proud of that. I am so proud of these nurses that accepted a challenge and honestly have been waiting for a program like the Pathway Initiative to provide the financial support and the social, academic, and cultural support as well, because they recognize that's what they needed to succeed. But I know that we have the largest number of American Indian, Alaska Native DNP students enrolled at any institution. And for that, I'm really proud of the University of Minnesota School of Nursing for the work that they've put in to help support these students. It's not just me, it is definitely a team and university effort.
The reason that you have 19 American Indian Native Alaska students is because the Ganawani program. So when you had that as a starting point, we wouldn't be able to have nurses who are prepared and ready to go into a PhD program had you not built the foundation.
Yes. So when I was working at Bemidji State, I stayed in communication with the School of Nursing because I wanted my BSN students to think about continuing their education. So Bemidji State and the University of Minnesota School of Nursing have had a collaborative relationship since 2017. And so when Naganawani was established, there were 5 American Indian nursing students in that program. Of between 400 and 500 students, 5 of them were American Indian. And by the time I left Bemidji State in 2021, they had around 26 students that they were providing support for. So it had grown quite quickly. And the numbers that we had graduated at that point were 17 maybe. But there are several other programs out there that I would also like to mention. The RAIN program at University of North Dakota, Recruitment and Retention of American Indians in Nursing. This is the longest standing program of support for American Indian nursing students. There's also the co-op program, Caring for Our Own at Montana State. Arizona State has the NCATS program. So there are multiple programs out there that support primarily at the undergraduate level. So yes, these provide great feeder programs for the Pathway Initiative if they don't already have PhD or DNP specialties within their own institutions. One of the things that I had the opportunity to experience as a master's student, I was part of a pathway program too, and I was able to get to know the faculty at the University of Minnesota prior to applying to the PhD program. And so having that level of comfort and knowledge and actually knowing people at the next institution that I was going to attend was so meaningful to me. And so that's one of the things that I work with undergraduate students, is getting them connected to folks in the university so they have that familiarity prior to their application process. And it just streamlines it and makes it easier and less frustrating for them, so we don't lose them at the application process. So just recognizing all of these cogs that keep it going to getting students from pre-licensure or RN to BS into doctoral programs, and the amount of work that it takes. And really, it's all about building relationships. I guess I can't stress that enough. And I tell students that I connect with and that I mentor, I'm with you for life. This isn't just getting you through your BSN or getting you through your DNP. I have students from 15 years ago that reach out to me and say, can you write a letter of recommendation? Now, we've kept in touch throughout the years, but this is a lifelong commitment for me. It isn't just getting them through their program and then saying, good luck. It's helping navigate their career path, or if they set another goal, being there to walk them through that or getting them connected to somebody else that could help.
Yeah, and it's a model. So they feel the protection and the care and the guidance of mama bear, and it teaches them how to be the mama bear over somebody's academic career. When you were saying that, it just reminds me when I see these headline nursing shortages and there's this idea of, oh, let's just go train more, as though just go training more is an easy endeavor. You have reminded us that it's complex. It is commitment. You've been doing some really wonderful work with Shadow Health in developing the very first American Indian digital patient and clinical experience and simulation. One of the things that they recognized is that the representation of Native Americans in media, literature, the press, in so many different spaces, it's been problematic. It's been inaccurate. I'm sure that there are many times where it's even been hurtful. And in order to approach care that is mindful, we really do have to have that authentic representation, not only of the person, but then how they might experience care. So this whole simulation. What I love about this is that Shadow Health, they had this acknowledgement. They reached out to you and they said, help us. So why don't you share a little bit more about the product and the project that you worked on with Shadow Health in creating this American Indian digital health patient clinical experience in the simulation?
Yes, so I was really excited to be asked because we used Shadow Health in our advanced health assessment course. So I was familiar with the product. I knew what it looked like to work on Tina, the patient, and do a head-to-toe assessment on her. So we created this maternal child scenario, and I knew right away that I wanted to use my own story as the inspiration for this. So the patient is Donis LaFontaine. She's an 18-year-old that is ready to give birth. And a few unique characteristics about Donis LaFontaine is her name, Donis, in Ojibwe means daughter. So I wanted to include that. Her last name, LaFontaine, at the time, there was a national story about Savannah LaFontaine Greywind, 22-year-old American Indian, who was brutally murdered by her upstairs neighbor, and she was pregnant. She was 36 weeks pregnant, and I wanted to bring some recognition and awareness to the epidemic of missing and murdered Indigenous women and to pay homage to Savannah LaFontaine Greywind. Even though students that are doing this clinical experience aren't going to make the connection, I knew that that's where her name came from. I would like to just give a follow-up that the baby survived this
very traumatic entry into the world.
Yes. She's 7 years old today, and her name is Hazley Joe. So there is some happiness to this tragedy. And from this, Savannah's Act was also passed in 2020 to bring more awareness to missing and murdered Indigenous women and to beef up the databases for missing and murdered Indigenous people.
So while we're doing this module that is focused on maternal care, that story also informs what are the different things that we should be aware of, be a solution to. So I think it is with great reverence and sacredness that we should be thinking of the name of our education model, that there's a lot to be learned from Donis LaFontaine. So let's get back to the clinical simulation and all the ways that you have infused the practices that we need to be aware of for the Indigenous patients that we're taking care of.
Yes. So remembering Donis is 18, young woman. So things that I incorporated into the simulation that students will have to pick up on or recognize is that Donis's mom, Rebecca, does a lot of the speaking. Whenever questions are asked about her healthcare, Rebecca, her mom, is the one that responds. And so being aware that this is a traditional practice where we have such reverence and respect for elders in the room, that they might be the ones speaking on behalf of the patient. So that's one cultural practice incorporated into the simulation. Another is Donis requests to bring the placenta home. And this goes for any body part, whether it's an amputated limb or a placenta. So in Donis's case with the placenta, there are many tribes that take the placenta home and bury it on their homelands. And that's the baby's home. So no matter where they are in the world, they will always be drawn back. Their spirit will be drawn back to their home, and shouldn't be an odd request. There are policies in place, hopefully, that support this practice. But I also know that there are facilities out there that make it much more challenging to do these things. But the student nurse will have to work through the request of Donis wanting to bring her placenta home.
I think a lot about the communication style. You mentioned that Rebecca, the mother, is doing a lot of the communication, but I've also experienced this myself where eye contact.
Yes, the eye contact is very important. It's a sign of respect. When you look at somebody in their eyes, it's like you're looking at the depths of their soul. And it can be so rude and disrespectful to do that to somebody that you don't know. And so it really is a sign of respect when there is that lack of eye contact. But there is a lot of confusion about whether or not Indigenous patient is paying attention, especially when you add in the fact that we're so comfortable with long periods of silence. So when you have a provider-patient interaction with an American Indian patient, you might have several seconds, which seems like an eternity, before they answer a question. And then they're not making eye contact with you. In your mind as the provider, you're thinking, well, did they even hear me? And so then you interrupt and you start talking again, while in that Indigenous person's mind, they're thinking very thoughtfully about what you just said, and they're articulating a response before they actually say it. And so this is something else that students may encounter in the simulation, is recognizing those periods of silence along with the eye contact. And what does that mean? And how do you deal with that?
One of the things that I'm thinking a lot about is, our National Heritage Months and the recognitions. And in November, it's been since, I think, 1995, that every president has issued an annual proclamation designating the month of November as a time to celebrate the cultures and accomplishments and contributions of Native American and Alaska Native communities. And part of the proclamation said, we celebrate by listening and learning to Indigenous and Native voices across the continent. And I love that you and I are having this conversation and modeling that. One of the roles that you play is director of the Center for Indigenous People, Health and Nursing of North America. Mm-hmm. And you have a very clear purpose and work of that center. And part of that is addressing disparities for historically underserved communities, to build respectful, collaborative relationships with the tribal nations, and also to really think about reconciliation. So I wanted to give you a moment to help us understand what the disparities are and what the work of reconciliation is.
The American Indian Alaska Native have some of the highest disparity rates of all the ethnic and minority populations, whether it's mental health, cancers, heart disease. We're at the top of the list in just about everything. So the purpose of the center is ultimately to address those health disparities. And I believe the way we get to that is we assist our tribal communities by building a relationship. American Indians have a lack of trust in non-Native people, especially government organizations, institutions of higher ed. There's a lack of trust there, and for good reason. There's been a lot of unethical research that has happened with our Indigenous populations. There are still people out there that want to study American Indian people because it'll give them access to more grant money. And they might not have the best interest at heart, which is the health of this community. And so that's what the center focuses on, is building relationships with our tribal communities. And in my mind, this is what it looks like. We connect with a tribal community that doesn't have a lot of resources. They're very small, they're very rural, they don't have a grant writer. They come up with a problem from their community that they would like to address. And the School of Nursing uses our resources to help write a grant together. The tribe is in charge of how it's implemented, how the data is disseminated, all of the things. So we can get them to the point of addressing an issue in their community, helping them become healthier, working collaboratively on a grant. So now they have the skills and the knowledge that they need to write their own grant in the future. And we can spread this throughout Minnesota and eventually across the United States. But initially, that's my vision of what I would like to see happen, is us collaborating with tribal communities and starting to address the disparities in such a simple way of just building a relationship and building that trust and helping to leverage some of the resources that the School of Nursing has to help that community.
As you're describing it, it makes perfect sense why the Center for Indigenous People and Health would be housed in a school of nursing.
Yes.
Because nurses take care of people in context of their families and their communities and taking care of the planet. Who better than Native Americans to be our guides and our teachers and help us to be better stewards of all of these beautiful riches and the gratitude that is just part of those traditions and wisdom, the ancient wisdom. When you tie all of those things together, how important it is to recognize there are disparities. We need to work with our partners to address them. And in addition to that, we're going to create the workforce that is going to be able to deliver on that and to teach. So it's nice to see that you are the center of many of these activities, and your personal insights, your care and concern, your trust, and your relationships are central to the success of all of this. So thank you for having a big, bold vision, for the courage to share your stories and to encourage other people to do the same. To step probably out of your comfort zone. And I'm very grateful to all of the people who maybe saw you struggling and maybe you didn't want to keep going. And they said, nope, not that easy, Misty.
Yes. Yeah.
So
one of the things that is easy to focus on with American Indians is the disparities. And I get, we are in a poor state of health. It's a fact. But I don't like to focus on that. I really want to be intentional about flipping the narrative and focusing on the positives and what American Indians bring to this country, what they have since it started. The phrase resilient or resiliency is often accompanied with American Indians. And my response to that is, I'm tired of being resilient. I don't want to have to be resilient anymore. I just want to be. And so to recognize we do have this power and this strength in our communities and the traditions and the language. And that's what gives me energy to do the work that I do is thinking about my ancestors and what they had to go through. I have a shirt that says, "I am my ancestors' wildest dreams." And it makes me emotional. I don't think my ancestors would have ever imagined somebody leading national programs and having influence on American Indian nurses and drawing on my ancestors' strength and what they had to endure is something that I am proud to bring to the work that I do, and just also want to lift up the positive and the power and the strength of American Indian people and Alaska Natives. And I don't want to end on disparities. I want to end on something good.
Your influence goes well beyond American Indian nurses. It is all people who care, those who have that license to touch. And you are absolutely a leader in helping us to care better and be better stewards. And the importance of thinking and speaking and talking in strength-based language as opposed to deficit-based language is absolutely vital.
This is just a really great example of how intentional you've been about learning. So I so appreciate that. Thank you so much.
Nurse researcher and educator Misty Wilkie is a proud member of the Bear Clan from the Turtle Mountain Band of Chippewa Indians in North Dakota and serves as the director of the Doctoral Education Pathway for American Indian Alaska Native nurses at the University of Minnesota School of Nursing, as well as serving as the director for the Center for Indigenous People, Health and Nursing. Deep thanks for Misty, her community, colleagues, and tribal ancestors for their enduring wisdom, strength, and stewardship, particularly as healers, protectors, and medicine finders. Representation in our healthcare workforce improves health outcomes in several ways, including building trust, improving communication and language support, promoting cultural sensitivity, reducing health disparities, and advocating for services. People just feel more comfortable and trust their healthcare providers when there's a shared background, language, heritage, identity, interests, and lived experience. Nursing leaders recognize the strong connection between a culturally diverse nursing workforce and the ability to provide quality, culturally competent, person-centered care. Nurses of underrepresented communities are more likely to advocate for services and programs for their communities, and nurses working and learning in places where, as Misty says, they see and are supported by others who've been in their shoes, lived like they have, and are more likely to enter and progress in their careers and pursue leadership roles. While nursing has made strides in recruiting and graduating nurses that mirror the communities they care for, there remains much more to do. And many more programs like the Pathway program Misty is leading and committed to are needed and necessary. The American Association of Colleges of Nursing's report on enhancing diversity in the nursing workforce highlights how few nurses from racial and ethnic minority groups with advanced degrees pursue faculty careers. And that is all the more reason why Misty Wilkie is her ancestors' wildest dream and an important pathway to healthcare workforces that are more representative and more responsive to the health and care needs of their communities. For See You Now, I'm Shauna Butler, and I'll let Misty have the last word.
Miigwech Bizandawiye, thank you for listening.
Nurses are transforming healthcare through innovation, compassion, and leadership. And Johnson & Johnson is proud to continue its 125-year commitment to champion nurses through recognition, skill building, leadership development, and more. The American Nurses Association is dedicated to building a culture of innovation. Nurses improve the lives of patients and communities through innovative thinking, empathetic connection, scientific rigor, and sheer determination. ANA is proud to support and advocate for our nation's most valuable healthcare resource. are nurses. For more information on See You Now and to listen to any of the earlier episodes in our library, visit seeyounowpodcast.com.